Welcome to the MedCoShare podcast, the podcast where we learn everything about what it's like to be a private practice healthcare practitioner in today's world. We dig deep into the challenges of being a healthcare practitioner, but also the rewarding aspects that the work entails. My name is Ronak Vyas, and I'm the CEO and co-founder of MedCoShare. Today's guest is Dr. Abhi Kasinadhuni. Dr. Kass has a background in internal and vascular medicine with a specialty in venous and lymphatic disease, focusing mainly on vein disease and ailments related to the veins. While training for his fellowship, he realized that many of his patients were interested in getting their veins fixed, like spider veins, which goes hand in hand with skin aesthetics. Since many professionals have practices centralized around aesthetics, his goal shifted to making this space better and more unique. In 2021, he came across men's medical aesthetics. As a male and a medical professional, he thought this was a wonderful concept and immediately saw the need for this type of space. Not long after, he opened Spartan MD in King of Prussia and then a second location in San Diego. Dr. Kass, welcome to the show.
Thank you very much, Ronak. How are you?
Good. So we've known each other for a few years now. You first became a MedCoShare member in our Fishtown location about 3 years ago. But before we get into that, just tell us a little bit about your background.
So I think you summed it up pretty nicely. I am trained in internal medicine and vascular medicine. I did my fellowship in that. I focus on venous and lymphatic disease and primarily in the outpatient setting there. I really enjoy the type of patients that I see in the vascular space, primarily because I have a procedural background. And the beauty and the phenomenal thing that I'm able to do is really restore, ambulation and restore quality of life in my patients that, I find to be the exact reason that I became a doctor. And so for that reason, I absolutely love what I do. And then what's more gratifying is, when my patients do come back and tell me, hey, I'm able to do all these things that I was never able to before. And that's the best compliment that I can get, that my work has had that much of an impact in their life.
Yeah, and you're married with 2 kids, right?
Yep, married with 2 kids, beautiful kids, wonderful ages. So my daughter's 3, my son's 1. My wife, I won't tell you her age, but she is beautiful and ever youthful. So yeah, and we have a wonderful golden. So the perfect family.
Nice. Yeah, I have 2 daughters myself, and a double doodle, which is one of these designer breeds, and just it was a COVID dog, right? So many people got pets during COVID, but no, we love this guy. So you do an amazing job as your day job, but the primary interest for me especially is your side gig, right, which is Spartan MD. So just tell us a little bit about that, what services you provide, and a little bit more about, why you wanted to start that.
Yeah, absolutely. And I think I'd love to clarify one thing here. I wouldn't want to give anybody the impression that the men's medical space is anything to the side or something that's complementing my main thing. I mean, I happen to devote more time to the vascular space, and I absolutely love doing that. I am passionate about it, and that's one of the reasons I joined medicine. But the beauty of medicine is that, especially in this day and age, there are so many specialties, subspecialties, focuses that don't have to be. So we don't have to be, single-pronged in our approach, and so. I love the fact that I get to participate in the vascular space, but I also love that I've been introduced to this niche, which is men's aesthetic medicine, which I would have never come across that had I not, taken a dive into this space. And I'd love to see this other thing grow because my personal feeling is that, men now more than ever do need not only the aesthetic component, not only the services that we offer in the aesthetic component, but even taking a step further, men's services relating to dermatology, primary care, mental health support. I think all of these services are necessary, and there should be services tailored to men, and that's why I took that dive.
Yeah, and it's definitely a growing trend. I think men just don't talk about it as much. but you see a need with so many different types of businesses that open up like yours. So tell us a little bit more about the services that you provide.
Yeah, absolutely. So some of our most popular services include hair transplant and hair restoration. We also do weight loss, anti-aging, peptides. In the sexual wellness division, we offer male enhancement, testosterone replacement. We also offer support with erectile dysfunction. And the overarching theme here is we really, really try to address the root cause, not just medically, but even psychologically. What is contributing to a person's, ultimately, what's affecting your body image, how you view yourself, and what's affecting your confidence on a day-to-day basis. So I think that what makes us really different here is that we don't take a black and white approach to, okay, yeah, you need a hair transplant, you've got a bald spot, no big deal, here's what we give you. No, we really talk you through the process and try to understand what's affecting you on a day-to-day basis, such that we're not only offering the hair restoration, but in doing so, we try to tackle every other health matter that might be affecting you. And so I like to view us as a more comprehensive service in that matter. And in that way, a number of our clients do come back for these other services or to get help in other facets of their life, because hair loss is not just hair loss. It's often associated with stress, weight gain, maybe altered hormone levels related to age or something more medical related. So in that way, we've been able to help our patients in not just treating one thing, but I guess all the stressors and conditions leading up to it.
Right. No, that makes sense. So what's the most popular service that you see demand for?
Hair transplant and male enhancement.
Okay.
Yep. The hair transplant's obvious because, as far as hair goes, I think hair loss is just a natural component of aging to some degree. But of course, in this day and age, with the type of diets that Americans consume, with the type of stress that we're undergoing, either due to our professional commitments or what we're seeing in our personal lives, and even the medical conditions that we are seeing, on the rise, all these things contribute to more than just a normal, amount of hair loss. And so the hair transplant the hair transplant, a lot of people know about. One thing I'd love to point out is our hair restoration services. Mm-hmm. A lot of folks are under the impression that you either get a hair transplant or nothing at all. And I love to highlight to patients that no, that's not your only solution. And there's a lot of stuff in between that one should consider. It can be something as mild as PRP therapy, exosomes, red light therapy, the use of pharmacological treatments to enhance hair growth. The beauty of it is that this is not just for men, but we also do get a fair amount of female clientele who also never knew that all these things existed. They'll come into our office thinking they need a hair transplant, when in reality they just needed a couple of minimally invasive injections or some pharmacological treatment to help boost their hair growth. And that's the coolest part of what we do, to let people know we actually have a bunch of stuff that we can offer. It's not like it used to be. Mm-hmm. And to that point, one of the things that we're starting to see more and more of is postpartum hair loss patients. Okay, so we get a lot of women, and I know the females can definitely relate to this. You have a baby, and in the months after, you have these tiny little baby hairs. I'm not talking about your actual baby, but you lose so much hair through that process that postpartum, you see these tiny little baby hairs growing out of your scalp because you lost hair. And so, I know a number of women, including my own wife, who was a little concerned with, hey, I had some significant hair loss. What do we do about this? Mm-hmm. And so our exosome therapy is a wonderful answer to that. And the beauty of it is it's not invasive. Again, it's just a few injections. It's a one-time treatment. You don't need to keep coming back every week or every month. So that's a lovely therapy. And then the other thing, I was telling you about is our male enhancement service. Right. And so that's also something quite proprietary that we offer. And, in that department, I mean, to be completely frank, male enhancement is penis enlargement. And so I know there are a number of men who feel that that's something they can't talk about. I'm sure they don't feel comfortable even talking about it with their partners because it's such a sensitive topic. But one of the things that we're trying to do is educate, advocate, and take the stigma away from some of these topics because it's important this day and age to address such things and to address those body image issues. And to that point, one of the conversations we have is, when people come in for consultations, we try to understand, hey, what's really going on here?
Right.
Do you feel that size is an issue, or do you feel like there's maybe some other component to this?
Yeah.
And that takes us back to understanding the patient. So we're not just trying to sell a service here. We really need to make sure that we understand the root of the problem.
Sure. And how much does something like that cost? And I'm only asking for a friend.
Well, your friend should definitely come in so that we can do a proper consultation. But the beauty of what we offer is it is a one-time service. So a lot of the services out there that offer any type of enhancement are usually every 6 months or a year because they're temporary services, but or a temporary solution. Ours is permanent. And so we do apply a filler that is a one-time deal, and the cost varies based on how much we need to do, what area we need to do, but it starts anywhere from roughly $7,000 and it goes up.
Okay. All right. So you're in 2 locations, in King of Prussia and San Diego. What has growth been like, and do you have plans for expansion?
Yeah, absolutely. Growth's been great. I mean, I think because men and women don't know that these services exist, part of our challenge, part of the challenge that we've faced is education. So folks need to be aware that this service exists to even start looking for the service. So, in the marketing world, this is sometimes referred to as a brand awareness campaign where we're not just trying to sell these services. We need to let people know why these services are even needed, or, what they are and the fact that they exist. So, that's part of it, part of the challenge, but it's been great. A lot more people at the same time are looking for this than one would imagine. Mm-hmm. And the fact that we are expanding and looking to grow, continuing to grow, I think, the sky's the limit. And in fact, the more we continue to educate, the more competition we see, the better it is for our market, because that means our niche is growing and it's no longer a niche. So I actually look forward to that. Yeah.
I mean, I can't imagine marketing being easy, but, just because the search term penile enlargements, right, they're probably not searching for those terms.
Yeah.
It's probably something else that's leading them to many other websites, I can imagine. So, I mean, how do you get new patients? What have you been doing to, make sure you get the right crowd?
Yeah, absolutely. So I think, word of mouth is really important, and that's been good for us. As far as digital marketing, we do rely heavily on that because, when it comes to digital marketing, that too, Google pay-per-click ads, people are seeking your service out. They're actively looking for what you're offering. And so it's really important for us to position ourselves in a way that, we accurately represent what we're providing, but also we give them a degree of confidence that, okay, we really are professionals and we're not trying to sell you a pill or a cream or something substandard, which unfortunately has plagued that industry of men's enhancement and enlargement. So and that too, like you said, it leads them down the wrong rabbit hole of much more explicit stuff, which is absolutely not what we're trying to attract.
Right.
And I think it's worth noting that a lot of our clientele, the men belong to a demographic quite different than what one would imagine. And that is a 30 to 55 demographic. They're generally a little bit more well-established. more often than not, they're in long-term relationships or married. Again, not always the case, but generally speaking, they have families. And I like to point this out because, this type of service, one would think maybe would be provided for a single gentleman trying to, explore, do more, and that sort of thing. And we actually don't see that as much. We see it, we see gentlemen coming from, long sustaining, healthy relationships. They're just trying to spice up their love life, or the gentlemen are trying to get a little bit more confidence, whether it's inside the bedroom or out. And the beauty of the procedure that we do is not only that it's permanent, but you get that permanent enhancement, whether flaccid or erect. And why is that relevant? I joke with my patients that, you're going to exude confidence from bedroom to boardroom. And so hopefully nobody trademarks that because I think I came up with it. But
that's a good slogan.
But really, I mean, if you take it back to primitive times, I would say that, whether it's sexuality or anything else, men really do, I guess they really relate a lot of their masculinity to the size of their genitalia or their performance. I think there's a strong, link there, a strong connect. And, right or wrong, I've heard a lot of my patients say the same, that, I just don't feel confident because of size or my ability to perform a certain way. And I think that, that feeling probably has existed for a long time, but, because we're in a day and age where people are talking maybe a little bit more, we're hearing more about it. And so, the important thing to note here is that, people are finally speaking out, and so that's why we can continue to address this issue and provide solutions, and that's why we're continuing to see the space grow.
No, absolutely, and thank you for this candid conversation. I know it's something that not a lot of people talk about, unless you're, online trying to scam other people. You see all these companies that just go down the wrong path, trying to pry on people's insecurities and take advantage of that. So, I appreciate your honesty here. Dr. Cass, this has been amazing. Where can patients find you?
So patients can find us online. You can look us up, SpartanMD.com. That's spelled SPARTAN, M for man, D for doctor.com. And listen, I think the hardest thing to do is taking that first step, reaching out. And I like to tell everybody that, there's no cost to doing that. Mm-hmm. In fact, if you have any question or concern whatsoever regarding the male enhancement procedure or anything else, the most important thing you can do is just reach out. And, our consultants are so wonderful. They're comforting, and we don't follow any kind of high-pressured sales approach like, maybe some other industries do. We really want to hear about, your background, your concerns, your health issues. And if we're lucky enough to gain your trust, then we'd love to help you out. And, the last thing that I like to point out is, again, whether it's in the male enhancement space or otherwise, like you said yourself, there's a lot of spam, a lot of phony stuff out there. Mm-hmm. And people ask me, did you ever envision yourself doing this, and how did you even end up in the space? I think the most important thing I like to convey is that there is always somebody else doing this, and they probably are, scamming people or not doing a great job. And so I'd rather be the trusted person that delivers a quality product and a quality service. And, if there is somebody out there doing substandard work, well, we want to be the light, that shines bright. So in a way where if you've got 10 guys, I want to be that one guy that does such a good job that you guys rely on me to deliver that service for you. So I don't know if that makes sense.
Yeah,
but,
that's perfect.
In a world of scammers, we want to be the good guys.
Yeah, no, and we need you. So
appreciate that.
Yeah, appreciate you coming on, and no, this was a great show. Thank you.
Yeah, no, thank you so much, and I hope we do it again.
MedCoShare provides turnkey medical office space for health and wellness providers. Our memberships are month to month, and providers can rent one or multiple rooms based on their needs. To learn more, please check out medcoshare.com or stop by one of our locations and get started today.
If you want to hear more of these conversations as we dig deeper into the lives of our members, please follow us on Spotify, Apple Music, or wherever you get your podcast. Follow us on social media to hear more from our doctors and nurses, as well as to keep updated on all things MedCoShare. We hope you'll join us on the next one, and until then, don't forget to practice your way.